Wade, a nursing student from Henderson State University, and I'm going to be doing a GI assessment today on my patient, Ryan. Okay, I would wash my hands starting out. I would note that the patient looks like he's generally doing well. He doesn't appear to be in any obvious distress or having any signs of pain. I would also check his vital signs first before I started my assessment. So initially during my inspection, I'm just going to note that the patient's abdomen is symmetrical on both sides. His stomach appears to be flat, and I don't notice any inflammation or bulging around his umbilicus. I don't notice any aortic pulsations or any peristalsis. He also doesn't appear to have any kind of scars or lesions or rashes anywhere. So I'm going to go ahead and auscultate, starting with the right lower quadrant. Patient's bowel sounds are normoactive with an appropriate amount of gurgles and squeaks. I'm now going to assess for any bruise. And I've worn my stethoscope at first. Okay, gonna listen for an aortic bruit. Then renal. Then iliac. Then femoral. Okay, no bruise were auscultated. Now I'm just going to listen for any friction rubs over the liver. Can you take a deep breath in for me? Okay, and over the spleen. Okay, now I'm going to percuss the abdomen and just listen for any signs of tympany or dullness and where one starts and the other stops. So we should have various degrees of both. Okay, now I'm going to percuss the liver for dullness and measure the diameter. So I'm going to start low enough, sorry. Okay, the diameter is about 6 centimeters, which is within normal limits. Now I'm going to percuss the spleen, the 6th intercostal space. Okay, and just tympanic noises are heard, so that is a normal finding. Alright, now we're going to do palpation. I've already placed the pillow under the patient's knees. Are you comfortable?
Yes.
He's going to try not to get ticklish during this also. Okay, we're going to start with light palpation over the abdomen. Just tell me if you have any pain, okay? Okay?
Okay.
Thanks. Anything?
No.
Okay, now we're going to do a deeper palpation over the abdomen. This is just like 2 to 3 centimeters deeper. If the patient was having any pain right now, then I would assess for rebound tenderness in that area. But as he previously stated, he's not. So I'm going to try to palpate the liver here. Thank you. Okay, will you take a deep breath for me? Okay, the liver edge is sharp and it feels smooth. Okay, I'm going to assess your spleen now. Oh, sorry. Good. If you'll just keep taking some deep breaths for me. Okay, don't feel the spleen, which is normal. Now we're going to try to palpate the kidneys. So that should be just below the liver. I'm going to press up on the back. You having any pain?
No.
Okay, last I'm going to try to palpate the aorta, which just should be to the left of the sternum. Okay, at this point in the assessment, I would ask the patient if he had any kind of costovertebral angle tenderness. Then I would do fist percussion and just have him turn to the back and sit up. If he had any ascites, then I would percuss the areas of tympani to dullness and just kind of map out a border for where that is. If he had symptoms for appendicitis, then I would assess for the Roughsing sign, psoas, and the obturator sign, which I would do that by palpating our left side of our abdomen to see if there was any associated right-sided pain. Then for the psoas sign, I would just ask the patient to lift up or flex his hip. Do you have any pain in your right lower side? Then the obturator sign, we would have him flip over to the left side, if you don't mind. We'd lift our leg up and then rotate it inwards, our hip. Are you having any right lower quadrant pain?
No.
Okay. So obturator sign would be negative. And then I would assess for Murphy's sign by palpating the liver edge, asking him to take a deep breath. And whenever he does that, if he did possibly have cholecystitis, then it would be painful upon expiration. All right, that's it.